Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. How long does Cosentyx take to work? Cosentyx, secukinumab, is an immunosuppressant that reduces the effects of a chemical substance in the body that can cause inflammation. Cosentyx is used to treat plaque psoriasis, ankylosing spondylitis, active psoriatic arthritis, active nonradiographic axial spondyloarthritis, nraxSpA, moderate to severe hidradenitis suppurativa, HS, in adults, and active enthesitisrelated arthritis, in specific patients. Cosentyx belong to a group of medicines called interleukin inhibitors. How long does Cosentyx take to work for skin plaque psoriasis? When taking Cosentyx, 300 mg, for skin psoriasis, the time it takes to get a 50% skin clearance is 3 weeks, median. To measure the severity of psoriasis, a score is used called the PASI, Psoriasis Area and Severity Index. This looks at how severe the skin lesions are and also the area of the body that is affected. This is what they use in studies to measure how well skin psoriasis medicines work. In studies they look for a reduction in PASI score, e.g. a PASI 25 would be a reduction in severity of psoriasis by 25%. By 12 weeks of Cosentyx treatment, the number of patients who had a 75% reduction in their psoriasis, PASI 75, was 77.1% of patients. Then by 16 weeks, the number of patients with a PASI 75 had increased to 86.7% of patients. The effect of Cosentyx on skin psoriasis starts within the first couple of weeks of starting the medication, and skin keeps improving even up to 4 months. Individual results may vary. How long does Cosentyx take to work for psoriatic arthritis? In clinical trials to measure how well or how fast psoriatic arthritis medicines work, a criteria was designed by ARC, American College of Rheumatology, that takes in consideration the different aspects of psoriatic arthritis. It measures the percentage of improvement there has been in psoriatic arthritis symptoms. An ACR 20 is a 20% improvement in symptoms, and ARC 50 is a 50% improvement in symptoms. In psoriatic arthritis, the time it takes for Cosentyx, 300 mg, to work to get 50% of the patients to have an ACR 20 is just over 4 weeks. By 16 weeks the number of psoriatic arthritis patients who had reached ARC 20 was 62.6%, and the percentage of patients who had reached ARC 50 was 39.6%. To measure the success of treatment for psoriatic arthritis medicines, it is also important to look whether there is a reduction or stoppage of disease progression. In the Future 5 study it showed that 91.8% of patients on Cosentyx 300 mg had no radiographic disease progression throughout the 52 weeks studied. Individual results may vary. How long does Cosentyx take to work for ankylosing spondylitis? Ankylosing spondylitis, AS, response to medicines is measured by assessment of SpondyloArthritis International Society, ASAS, response criteria. This looks at 4 different areas of assessment, called domains, of AS. An ASAS 20 is an improvement of at least 20%, plus an absolute improvement of 1 unit of 3 domains without a worsening of the other domain. An ASAS 40 is an improvement of at least 40%, when on Cosentyx, 150 mg, for ankylosing spondylitis the time it takes to get 50% of the patients to have an ASAS 20, 20% improvement in AS, response is approximately 3 weeks. The ASAS 40 response at 3 weeks is over 20%, and the number of patients in this group continues to increase up until 8 weeks. By 16 weeks the number of patients who had an ASAS 20 response in their AS had increased up to 61.1% of patients, and the number of patients who had an ASAS 40 response was 36.1%. Ankylosing spondylitis is a disease that causes health to worsen over time, if it is not treated. The success of ankylosing spondylitis treatment can also be measured by whether there is a reduction or halt of disease progression. In the Measure 1 study, X-rays showed that 79% of patients on long-term Cosentyx 150 mg therapy had no definite disease progression. Individual results may vary. How long does Cosentyx take to work for non-radiographic axial spondyloarthritis? Non-radiographic axial spondyloarthritis response to medicines is measured by the percentage of people who have a 40% improvement in assessment of Spondyloarthritis International Society, ASAS 40. In the clinical trial called nraxSpA 1 by 16 weeks 13% of patients with non-radiographic axial spondyloarthritis had a response of ASA 40% improvement, and this increased to 19% by week 52. This was the difference between using a placebo and Cosentyx 150 mg monthly. Individual results may vary. Related questions: what are monoclonal antibodies? How does Taltz compare to Cosentyx for psoriatic arthritis? Cosentyx versus Humira, how do they compare? How long does Cosentyx take to work for enthesitis-related arthritis? In clinical trials to measure how well or how fast medicines work for the types of juvenile idiopathic arthritis, JIA, they use the system designed by ARC, American College of Rheumatology. It takes into consideration core set variables, CRV, and the percentage of improvement in symptoms. JICR 30 response criteria is defined as a greater than or equal to 30% improvement in 3 or more of 6 CRVs, with no more than one of the remaining CRVs worsening by greater than 30%. Enthesitis-related arthritis, ERA, is a subtype of juvenile idiopathic arthritis, JIA. In the clinical trial, Phase 3 Juniper trial, NCT 03031782, using secukinumab to treat JAR, both enthesitis-related arthritis and juvenile psoriatic arthritis, in week 1 33.7% of patients had a JAR-CR 30. By week 4, JAR-CR 30 had increased to 81.4%, and by week 12, JAR-CR 30 was 87.2%. In the same trial using secukinumab to treat ERA, at week 12 of the trial 84.6% had a JAR-CR 30, 78.8% had a JAR-CR 50, 65.4% had a JCR 70, 32.7% had a JAR-CR 90, and 26.9% had a JCR 100. The number of patients at 12 weeks with the inactive disease was 38.5%. The number of patients at 12 weeks who had a resolution of enthesitis was 72.3%, and 50% had resolution of dactylitis. Individual results may vary. How long does Cosentyx take to work for hidradenitis suppurativa? Cosentyx for hidradenitis suppurativa started working as early as week 2, and by 16 weeks in the Sunshine trial 44.5% of Cosentyx patients achieved HiSCR50 compared 29.4% of placebo patients. Improvement of HS is measured by hidradenitis suppurativa clinical response, HiSCR50, which is defined as at least a 50% decrease in abscess and inflammatory nodule, an count with no increase in the number of abscesses and/or draining tunnels. Individual results may vary. What conditions is Cosentyx an approved medicine by the FDA? Cosentyx is FDA approved specifically to treat these patients. Moderate to severe plaque psoriasis, raised, silvery flaking of the skin, in patients 6 years and older, who are candidates for systemic therapy or phototherapy. Active psoriatic arthritis, PSA, for patients 2 years and older. Active ankylosing spondylitis, AS, in adults. Active non-radiographic axial spondyloarthritis, nraxSpA, in adults, who have objective signs of inflammation. Active enthesitis-related arthritis, ERA, in patients who are 4 years and older. Moderate to severe hidradenitis suppurativa, HS, in adults. Bottom line. The time it takes to get a 50% skin clearance, PASI 50, for psoriasis is 3 weeks, median, when using 300 mg dose of Cosentyx. In psoriatic arthritis the time it takes for Cosentyx, 300 mg, To get 50% of the patients to have an ACR 20 is just over 4 weeks. When on a dose of 150 mg Cosentyx for ankylosing spondylitis, the time it takes to get 50% of the patients to have an ACR 20 response is just 3 weeks. The ACR 40 response at 3 weeks is over 20%, and number of patients getting to ACR 40 continues to increase up until 8 weeks. For non-radiographic axial spondyloarthritis, 13% of patients have an ACR 40, 40% improvement, at 16 weeks, which increases up to 19% by 52 weeks. These figures are the difference between using placebo and Cosentyx 150 mg monthly. For enthesitis-related arthritis by week 4, 81.4% had achieved ACR 30. For hidradenitis suppurativa, Cosentyx started working as early as week 2, and by 16 weeks 44.5% of Cosentyx patients achieved HISC 50 compared 29.4% of placebo patients. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.